Why are so many patients still misdiagnosed when they have underlying heart valve disease? Hello, I'm Inder Birdi, consultant cardiac surgeon and clinical director of the Keyhole Heart Clinic in London. This video is for educational purposes only, but I'm confident you'll find it extremely useful. Today, I want to talk to you about something we see far too often as heart surgeons, and that's heart valve disease being mislabeled or misdiagnosed. I'll walk you through why this happens and highlight the signs you can look out for if you're worried about this. First, what is heart valve disease? It happens when one or more of the valves in our heart become either narrowed, which we call stenosis, or leaky, known as regurgitation. These problems prevent blood from flowing properly through the heart, and over time, this puts strain on the heart muscle and, of course, other organs. The two most common types we see are aortic stenosis and mitral regurgitation. Both can be serious, but the symptoms are often subtle and in the early stages can be missed altogether. The classic symptoms, of course, are breathlessness, fatigue, reduced exercise tolerance, feeling lightheaded or dizzy, and palpitations. And these are easy to dismiss as aging or stress or just feeling out of shape. And here's a challenge, you see, your GP isn't a heart surgeon and they just don't have access to the tools we as clinicians have in specialised clinics. They, for example, may only have a stethoscope, and I truly sympathise. It's not always easy to make an early diagnosis of valve disease without imaging. But delays don't just happen in general practice, they sometimes even happen in secondary care, and it can take too long to investigate symptoms sometimes. This means, of course, that some of the benefits of early treatment can be lost. We often see patients months, sometimes years after being told they've got asthma or anxiety or long COVID, or that there's really nothing wrong at all, when in actual fact there is. Heart valve disease, of course, though, is very serious. If it's missed in the early stages, valve disease can progress, and by the time it's diagnosed, the heart muscle might already be affected. That can then make the surgery riskier and can even make keyhole procedures no longer an option. It can also significantly affect quality of life. Now, to properly diagnose valve disease, we need imaging. And specifically, we need something called an echocardiogram. That's an ultrasound of the heart. It's painless, it takes around 20 minutes and gives us clear information about the valves, which are working, which are not, and how the rest of the heart is responding to any dysfunction. I guess at the end of the day, the most important question is, what can you do if you think you've got a heart valve problem? First, it's important to be aware. Heart valve disease is very common. If you or someone close to you is experiencing breathlessness, fatigue, reduced fitness, especially if you're over 40, insist on a heart check. And that means a proper clinical examination, a referral to a cardiologist, and crucially, an echocardiogram. Second, don't be afraid to seek a second opinion. We frequently see patients who are told that everything was fine, only for significant valve disease to be picked up on imaging. Now, at the Keyhole Heart Clinic, we offer a rapid valve assessment service. This includes an ECG, an echocardiogram, and a full consultation with an answer the same day. Catching heart valve disease is really important. If we catch it early, we minimise the damage that it's caused and maximise the opportunity for us to treat those conditions minimally invasively. If you want to know more about heart screening or feel you may need a second opinion, click the link in the description to get in touch. We're here to help. There's no pressure, just clear professional advice. Thanks for watching. If you found this useful, please share it with someone who might benefit too. And don't forget, subscribe for more videos on heart health and treatment options. Bye for now.